a new paradigm. Perhaps it's time to revisit the role of therapists and the therapy industrial complex. Clinical diagnosis is an important tool to guide best practice treatment for many people in acute psychiatric distress. But is it possible that the $100 billion per year therapy business, and it is a business, may be, for less acute clients, perpetuating and exacerbating psychological issues, almost in the form of a social contagion effect, as was mentioned previously, where clients become habituated to be unwell and emulate unwell models? Is it possible that we have medicalized and pathologized entirely natural psychological processes, and in doing so have created a paternalistic dependency model that now requires paid therapists who create psychological dragons that only they can slay? Natural human processes like stress, adversity, trauma, and shame have not only been pathologized, but have entire theoretical models with their respective therapist superstars, Oprah-endorsed, of course, that have created clinical monsters that then require medical or therapeutic interventions to conquer. But we had been warned about this. 20th century psychiatrist Thomas Szasz was an influential thinker who spoke out against the pathologizing of people as a form of control, that the psychologists and therapists of the day were the new secularized priests and shamans who dictated what was acceptable and normative behavior. He also argued that mental illness was simply a conceptual metaphor for everyday human problems, and shied away from a reliance on the DSM, the Diagnostic Bible for Mental Health Workers. So too did author and analyst James Hillman, and his acorn theory. He also believed that we were pathologizing things that were really just natural or necessary processes by which an individual responded in order to optimally grow, from acorn to oak tree. For example, the child who gets diagnosed with selective mutism, yet simply needed to listen more over a longer period of time, who then flourishes in their linguistic abilities. But dragons are only dragons if we believe that they are. Our perception of our challenges is a key component in how they impact us. How we understand and frame things is critically important with regard to our mental health. That is, if we perceive or define something as being problematic, then it can become toxic or take on more harmful features. Let's take stress as an example. We've all heard the phrase, stress kills, and many do everything that they can in order to reduce their stress because they believe that stress equals bad. But as health psychologist Kelly McGonigal points out in her book, The Upside of Stress, and in her captivating TED Talk, research has shown that it's not stress that kills, but our beliefs regarding stress that actually make it harmful to us. In large longitudinal studies, researchers found that people who had high stress and a high belief that stress is harmful had the highest mortality rates. But amazingly, the people who had the lowest mortality rates were not the low-stress people. Instead, it was the people who had high stress, but, and this is the key point, they did not choose to believe that stress was harmful. They accepted it as a natural human occurrence. So the reality is that stress can actually be beneficial, as it builds resilience and, via the release of the neurohormone oxytocin, the so-called cuddle hormone, that's released during times of high stress, we are propelled to reach out to other people and be more social when times are difficult. Incredibly, biologically hardwiring us toward healing socialization. The stress hormone oxytocin is also cardioprotective and helps heart cells heal from any stress-induced damage. In fact, McGonigal looked at the cardiac profile of stress participants in the research study who believed that stress wasn't harmful and discovered something quite amazing. Their blood vessels weren't constricted like the typical high-stress, stress-is-bad patient. Instead, their heart vessels resembled the same dilated profile of a person experiencing courage. It's a powerful